All right, next up we have the Ely's test. This test is a test for rectus femoris tightness. Basically what you're going to have your patient do is lay in the prone position. They're going to be fully prone, their knees will be straight to start. What we're going to do is we're going to flex the patient's knee on the affected side. We're assessing here if they have hip flexor tightness, which is out of all the hip flexors, we're trying to isolate the rectus femoris. And the reason we do that is because of its insertion on the pelvis all the way down to the tibial tubercle. So when we flex the knee, we might see some changes occur up near the pelvis. So you typically would do this on the same side, but for sake of the video, I'm going to stand on the opposite side so you can see. We're going to look at this individual's right knee, right leg, and what you're going to do is palpate under the ASIS here, and then you're going to passively flex this person's knee just like you're doing a quad stretch, for instance. And what you're trying to assess here with at the hip is if they're getting any tenting up of the pelvis or any rotation of the pelvis. So as we passively flex this individual's knee, we're assessing there to see if there's changes occurring at the hip. And so one thing that I can assess here is just quad tightness. This individual has about 120 degrees of knee flexion before we start getting into R1 of a restriction. If we keep going, right, then we might start to see pelvic, we call it tenting, where their pelvis rotates or their pelvis flexes where they're trying to get out of that position because the rectus is too tight. So a positive test would be indicated by, as we mentioned before, compensations up at the pelvic or lumbar area trying to get out of that position.